Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, jet fuel spills into the water supply of more than 60,000 people. What are the risks to their health? That was the question facing a committee of the National Academies of Science, Engineering, and Medicine. Two members of this committee, Professor Andrew Whelton of Purdue University and Johns Hopkins Professor Natalie Exum, joined Dr. Josh Sharfstein to talk about the spill, which took place at the Red Hill Bulk Fuel Storage Facility on the island of Oahu in Hawaii in November 2021. Let's listen.
Professor Whelton, Professor Exum, thank you so much for joining me today, Public Health on Call, to talk about the Red Hill water crisis. Now, some people who are listening might be thinking, the Red Hill water crisis, I've been thinking about that for months now. I can't believe there's a Public Health on Call episode. And other people will be thinking, I've never heard of the Red Hill water crisis. So I'm going to first maybe turn to you, Professor Whelton. If you could introduce yourself and maybe give some of the basic facts about what happened here.
Great. So thanks for having us. I'm a professor of civil and environmental engineering at Purdue University. And my expertise is understanding when bad things happen, what the health risks are, how do we find them, remove them, and make the community safe again.
Great. So what happened out in Hawaii here?
Well, what happened, simply put, is that a bunch of jet fuel was spilled into the water supply of a community of about 93,000 people. And then that fuel contaminated water was then pumped through a buried water piping network and delivered to people's homes and businesses and resulted in exposures.
And this is located at the Pearl Harbor base, is that right?
Yes, there's a base that's set up it's called the Joint Base Pearl Harbor, HICM, and it's a tri-service base, so there's multiple parts of the military that are present.
When did it start?
The fuel water contamination incident that many people heard about occurred around November of 2021. At the time of the spill, there were at least 60,000 people that were relying on the water supply and upwards of 93,000 that we believe were using it in some way, shape, or form.
And it's a pretty large spill, or was it, a couple drops of jet fuel? Give us a sense of how much we're talking about here.
Well, the November 2021 incident involved thousands of gallons of jet fuel, but over the years before this November 2021 incident, there were releases and spills that made their way to groundwater. And so we don't necessarily understand how much fuel was in the groundwater, but we know that it was certainly an issue for a public health safety standpoint.
All right. So towards the end of 2021, November, there is a spill of thousands of gallons of jet fuel into the water supply for more than 60,000 people.
The way people found out was that they detected odors in their water or had physical symptoms, rashes, and other types of health impacts. They were not happy about it, and that's primarily because of the officials didn't necessarily understand at the time that they were pumping jet fuel contaminated water to the people on the base and outside the base.
So people start complaining about how their water smells, how it tastes, and there's confusion about what's actually happening. And then they find out, well, it was thousands of gallons of jet fuel that got into your water supply.
Yes, and that contaminated water and jet fuel was pumped to people's homes and businesses and the like, which resulted in somewhat of a quagmire where now we had to decontaminate the entire system and do testing.
Got it. And I'm going to bring in Professor Exum here. I know both of you served on a National Academy panel to try to figure out some of the health implications of this situation. You're not representing the academies on this podcast, but I want to ask, before we get into what you found, what were really the key questions that the community, the naval base, and others wanted answered after this spill?
we were brought onto this committee to understand exposures. And really that was the main question. Who was exposed? For how long were they exposed? And really how much jet fuel did they drink? Were they bathing in? And did they inhale? Because, it is volatile once it kind of works its way through the pipe. So a really challenging exposure assessment situation.
What are the substances in jet fuel? Jet fuel, it sounds kind of scary.
Yeah, there's a lot of different types, right? And so the one that we were dealing with here was JP5. And, there's de-icers in there. There's all kinds of, it's not just jet fuel, and there's lots of different chemical constituents. There's so many different additives that the military puts in there to ensure that this is going to, keep our equipment in good shape. So
it's quite a mix of chemicals, more than 60,000 people potentially exposed. And you get called in to figure out what the actual exposure was and what the potential health consequences are. Professor Whelton, seems like high stakes for this report.
This study committee was really exceptional in a sense that there were so many global leaders in their disciplines, medical doctors, pediatricians, epidemiologists, exposure scientists, that converged for this opportunity. And so it was extremely important that all these different disciplines were brought together, but it was also just amazing to be a part of it and to come together to put this report and recommendations together for the nation.
Professor Exum, did the committee meet with some of the people who had been exposed to the water?
Yeah, and this was a really important part of our approach, which was our community liaisons, who we held 3 separate listening sessions with people who were affected, and really trying to take both the water quality data that had been collected and really understanding through both the science, but then also people's lived experience of how, what happened to their children when they put their children in the bathwater because they were told, don't drink and cook with it, but, you could shower in it, right? So there's a lot of confusion around the messaging about what was safe to do. And so hearing from people who were there was critical to how we understood exposures and in our recommendations.
Yeah, what was that like to listen to people? Were they...
Gosh, heartbreaking.
Yeah, tell me more.
So particularly as a mother, there's so much, you could just hear so much guilt that they had kind of continually allowed their children to be, really for me, it was the bathing factor here, right? Because we know our kids are more vulnerable, they're smaller, their threshold for safety is so much lower, and they were absorbing it through their skin and potentially inhaling it when they were in these baths.
And Professor Whelton, was there anger that you guys sensed from people who'd been exposed here?
Certainly, and rightly so, because we are in the United States of America and expect water to exit our faucets because we're told it's safe. There's laws that require it being safe, and it was not safe when it was delivered.
So, very intense situation, and you got to get to answers. Let's start with that first question about exposure. What did you all determine, and how did you go about figuring this out? But what did you find in terms of how much exposure to jet fuel did people actually have?
We do know that people were actually exposed to emulsified jet fuel. So jet fuel was literally present in the water, not dissolved where you couldn't see it. You could see it. And so we know that people had direct exposures to that. One of the challenges is that because of the limited data that was available, we couldn't necessarily predict if you were in this house, you were exposed to this much. If you were in this house, you were exposed to this much. And so it's primarily based upon the lack of collecting data in a way that could make that decision, inhibited us from determining for the people inside their homes or at the commercial businesses what they're exposed to. As far as the health impacts, Dr. Exum and I relied on the health experts that were brought in, the epidemiologists, the medical doctors that were actually practicing in the area and such to give some feedback. But they definitely had reports of rashes, nausea, vomiting, lethargy, a number of there's some neurological symptoms as well for health impacts. And that is all outlined in the report, and really important that studies are commissioned to kind of figure this out, because it's not just this community in the Pearl Harbor area. Several months ago, we heard about a jet fuel spill in Atlanta, Georgia, where civilian jet fuel went off and the drinking water utility was concerned that they sucked it up and started providing it. Months before that, we found about jet fuel spill out in Pennsylvania, where somebody's well actually was filled up with jet fuel and they were pumping it into their home. And they had the same health questions that the people in Pearl Harbor had. And that's why it's really important that this work kind of be conducted.
Got it. So is there a clear knowledge of what happens if you have this exposure, or is this something that hasn't really adequately been studied yet? Professor Exum?
Our report shows that there is limited or suggestive evidence of associations with more acute respiratory, skin, gastrointestinal, and even mental health symptoms, but we do not know these long-term neurological, cognitive. There's no data out there that the committee could rely on to say that there's anything definitive.
Got it. So far we know you were exposed, but we don't know how much exactly each person was exposed. We know that there can be some short-term effects, but we don't know much about the long-term effects. But then you recommended that there be a lot of follow-up. So Professor Whelton, could you talk about the follow-up that you all recommended?
Simply put, we can figure out fairly quickly what people are exposed to, at least get some idea. And so those efforts need to be done by an external party to what chemicals were there, what are the health risks, where did they go, and how long were they around that people were then being exposed to during facility decontamination and building. All that can be figured out. We do this all the time, but it requires somebody taking action to then fund that effort because it takes effort. So within 6 months to a year, somebody could figure that out.
And they could figure it out down to the level of a household, do you think?
Yes, I think so. They could, based on my experience in other disasters, we're able to predict inhalation exposures, using contaminated water in a dishwasher or when you're taking a shower or bathing. And so we could provide that data to exposure scientists who can then determine the potential health impacts and also incorporate that information into their long-term biomonitoring kind of studies.
Got it. So that's exposure by drinking, exposure by inhaling, the vapors, and in theory, each family could get a number that would kind of indicate their degree of exposure.
Exactly.
That sounds pretty important. Do you think something like that is likely to happen?
So I'm hopeful that the powers that be see the importance of not only helping military families and dependents understand what happened to them and provide them care in the future based on their exposures, but it's a national issue. Petroleum is the most spilled chemical in the United States, and it's affecting communities nationwide. And so all of these questions that surfaced in Pearl Harbor keep happening across the country. So from a national resilience perspective, from a community stability perspective, and just from a consideration of taking care of our men and women and their families in the military, I think it should be done, and I'm really hoping the powers that be move in that direction.
Totally makes sense. Now, Professor Exum, what about the health follow-up? What did you recommend?
Yeah, so the clinical follow-up really was the purpose of this report. So the main recommendations there are that clinicians need to go on symptoms and evaluation and providing continuity of primary care, which in the United States can be very challenging, especially when you have many military families that have moved off base. And so really how to get as many of those, hopefully this report will be a way to bring people back in to say, now there's a place for you to register yourself. Now there's this continuity of care for you to be able to document your symptoms if symptoms develop in, years that follow. So this report is a really important inflection point to get that word out. Those families that were in the Joint Base Pearl Harbor Hickam water system at the time of the spill in November 2021. So that is really important.
So families who were exposed will be able to be in a registry. Will that allow for studies over time to assess whether there's an elevated risk of a particular outcome? So, for example, if some people get a particular type of cancer, you'll be able to do a study and say, well, in reality, was that more likely if you had an exposure?
Yeah, so there is something called the Defense Occupational and Environmental Health Readiness System, the DOORS registry. This documents these occupational and environmental exposures for service members and their beneficiaries. And so this system is very important to have their exposure records linked into this there's an individual longitudinal exposure record that supports the military health system and the VA records. that is so essential for these studies to be done in the long term and really understand what's happening.
And to do that exposure assessment, then that's in with the medical record. So you could see whether the people who had greater exposure had a greater risk for particular outcomes. That's one way to assess causality, whether the exposure itself led to the health consequence. Got it. Now, Professor Whelton, you've been talking about the fact that this is not completely unique, that there are jet fuel exposures in other parts of the country. What do you think the big lessons are from what happened in Hawaii because of the leaks from the Red Hill bulk fuel storage facility?
So that's a loaded question. What I would say, simply put, is looking forward, we need to make sure, especially for our men and women in the military and their dependents, that they are taken care of. That accidents do happen, but the whole effort of the government needs to come in and support them in the long-term health effects monitoring, support, care, and such, especially for the children that were impacted by this, because they are the future of what we want, and we need to make sure that that compassion and care is there. I would say how not to have it happen again. There have been after-action reports by different agencies about this, but systemically, this is a nationwide cross-cutting problem with how decisions are made when bad things happen like contamination. And we need to operationalize and standardize the lessons learned from this and cutting through the bureaucracy, but then integrating the scientific evidence-based decisions to make sure that we find the contamination, we stop the exposures, and then we remove it as fast as possible so that we don't have to worry about long-term issues. I mean, ultimately, let's not worry about long-term issues if we can just avoid it or stop it from happening in the first place.
Yeah, and Professor Exum, people generally take clean water for granted, but do we need more attention to what can be done to keep it clean?
Yeah, especially with this event, it's important to recognize here that this bulk storage fuel facility had been around since the World War, and we were storing giant tanks of fuel above an aquifer, a precious aquifer that was almost a sole source for the whole island. So the lesson here is knowing that was a hazard, and knowing that was stored so close to the drinking water for most of the island. That hazard is now removed, which is a huge triumph for the long-term health of the residents on Oahu. But I think we need to take a grander view here and say, what are those other hazards? Prevention is the best way to keep water clean. And so thinking into the future, really being able to identify those hazards and then mitigate them before these spills happen.
Well, Professor Exum, Professor Whelton, thank you so much for coming to talk to us about this very difficult situation in Hawaii and what is going to be done to understand more and hopefully use this knowledge to prevent other catastrophes.
Thanks for having us.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.